Today I am going to tell you about various structures that can be seen on this model of lower limb. So we'll start from here. This is the iliac crest, this is pubic tubercle, and this is anterior superior iliac spine. Between these two structures we have the inguinal ligament. Here this muscle is the psoas major muscle, and this is the iliacus muscle in the iliac fossa of hip bone. The nerve that we can see here is the femoral nerve, and this is the external iliac artery, and this is external iliac vein. Now coming towards the anterior compartment of thigh, the first muscle that we can see is the sartorius. If we remove it, we can see this is rectus femoris muscle, this is vastus medialis muscle, and this is vastus lateralis. If we remove rectus femoris, this is vastus intermedius. This muscle here is the tensor fascia lata, and this whitish structure is the iliotibial tract. This is iliotibial tract, and this is tensor fascia lata. This vessel, which is a continuation of the external iliac vein, is the femoral vein. This is femoral artery, which is the continuation of external iliac artery, and this is femoral nerve. Here, this is the branch of femoral artery, which is the lateral circumflex femoral artery, and this is its descending branch. This is another important branch of femoral artery, which is the profunda femoris artery. This muscle here is the combination of psoas and iliacus, hence it is called the iliopsoas muscle. This is pectineus, and this is adductor longus. Now coming to the medial compartment of thigh, the muscle that we have seen in the anterior compartment, the sartorius muscle, then is the adductor longus muscle, then is the gracilis muscle, and finally we have the adductor magnus muscle. Now I am going to tell you about the posterior thigh. So here, starting from the medial part of a medial compartment, this is the adductor magnus muscle. The next muscle, which is on the posterior compartment of thigh, is semitendinosus. Here, this is semitendinosus, having the long tendon, and the semimembranosus muscle beneath it. And then on the lateral side is the long head of biceps femoris muscle. If we remove it, we can see the short head of biceps femoris muscle. This is the remaining part of the adductor magnus muscle. Now coming to this area of the gluteal region, this is the gluteus maximus has been removed. This muscle is the gluteus medius muscle. This is piriformis. Just below it is the superior gemellus. Then is the obturator internus muscle. Beneath it is gemellus inferior muscle, and this square shaped muscle is the quadratus femoris muscle. This nerve that we can see, this thick nerve, is the sciatic nerve. As it goes down, it divides into two terminal branches. The lateral one is the common peroneal nerve, and medial one is the tibial nerve. And this is the popliteal vein, the tibial nerve, and the popliteal artery. The popliteal artery is a continuation of femoral artery from above. Popliteal vein continues as femoral vein, and these three structures lie in the popliteal fossa. This enters the popliteal, the femoral vein. Popliteal vein enters into the adductor hiatus to become the femoral vein. This is the adductor hiatus. Now, just above the piriformis is the superior gluteal artery, and below is the inferior gluteal artery. This one is the lateral circumflex femoral artery, and these are the perforator arteries, which are branches of the profunda femoris artery, supplying the muscles here. And this bluish structure is the sacrotuberous ligament.